Of all the children who are passengers in motor vehicles on Ontario and Quebec roads, only 28% who should be using booster seats actually use these important safety devices. That means that every day, more than 70% of the children riding in our cars, trucks, and minivans are at risk of serious injury and even death. This frightening statistic has doctors, hospitals, police, and public health officials calling on parents to prevent these potential tragedies.
The problem is that seatbelts are designed to fit adult bodies and they don't hold children as securely. That's where booster seats come in. By raising the child up, booster seats correct the fit of the vehicle's lap and shoulder belts. The seatbelt then fits properly over the child's body. This decreases the risk of injury the seatbelt can cause in the event of a crash. Parents need to remember that children aren't tall enough to ride without a booster seat until they are at least 4 feet 9 inches or 145 centimeters tall.
We see the consequences of motor vehicle collisions every day at Children's Hospital, London Health Sciences Centre. Over the last 2 years, 174 children under the age of 10 were seen in our emergency department as a result of car crashes. 13 of them suffered severe injuries. We found that when compared to children who were treated in the ER then discharged, the more severely injured children were more likely to not be using protective devices or to not be using them properly. The consequences of not using the appropriate booster seat or child restraint, or the failure to use them as intended, can be severe and can last a lifetime. Without a booster seat, the lap belt can rest on the child's stomach, which could cause stomach, liver, or spleen damage in the event of a crash. And if the shoulder belt rests against a child's neck rather than their chest, they may try to move it under their arm, where it could crack their ribs and damage internal organs. Or they could put it behind their back, where it offers no protection at all against head, neck, and spinal injuries.
Parents can switch to a booster seat once their child weighs more than 18 kilograms or 40 pounds. Booster seats must be used until your child reaches one of the following. They weigh 36 kilograms or 80 pounds, they turn 8 years old, or they reach a minimum height of 145 centimeters or 4 foot 9 inches. Drivers who fail to use booster seats can face a $240 fine and 2 demerit points. But the fine is nothing compared to the consequences of an injury or death of a child. It only makes sense, so please use a booster seat for your child.
To speak to someone about booster seats, call the Child Safety Line at 519-663-5317, extension 3755, or email childsafety@mlhu.on.ca. Find out more information about booster seats at www.healthunit.com/booster-seats.